Hi, I'm Fran from SJP Law, and I'm joined today by Dr. Nicola Winfield, who's a clinical psychologist with 20 years' experience in both the NHS and private practice. Good afternoon, Nicola.
Good afternoon, Fran. Great to see you again.
And you. Please, could you tell us a little bit more about your background, if possible?
So, as you kindly said, over 20 years' experience. I started out in the NHS, and then I've quite recently moved into the private sector. And I provide psychological assessments, both for medical legal purposes and for therapy, and also provide therapy to clients with a really wide range of problems such as anxiety, depression, post-traumatic stress disorder.
So we work with you in partnership to assess a number of our clients who have been catastrophically injured, so with the main purpose of trying to establish the extent of their psychological injury and plan for their future treatment. We've developed this short webinar in order to really capture the changes that have been brought about to therapy by COVID-19 and hopefully give our clients and the wider public who may be in receipt of therapy some practical tips on how to get the most out of an online session. So Nicola, is online therapy suitable for everybody?
There's a really big evidence base now to show that therapy can be delivered competently by different media such as video and telephone, and it's usually acceptable to the client. Most people are really quite comfortable with it once it gets going, and that it's really possible now to build those therapeutic relationships just as you would in a face-to-face setting, and they can be just as strong as if you were in a room together. So I think it's really important before we start thinking about this to consider the impact of actually cancelling or postponing an assessment or therapy for a client. COVID, obviously, we don't always know how long it's going to be before we can return fully to face-to-face. And so I think the discussion with the client around whether they would consider alternative means of delivery is really valuable.
Have you noticed a difference since the beginning of the pandemic in terms of your existing and more established clients and developing that rapport online versus the new clients that you take on and a brand new assessment being delivered online? Do you find that you can still establish that rapport quite easily?
Yes, it's been really positive. The clients that I was working with face-to-face before the pandemic have adapted really seamlessly, I guess because we already had that relationship built up. New clients, I tend to try and speak to people on the phone and start to build that rapport, the relationship, talk about sort of the media that they're comfortable with, what they would like to use, lots about how it's going to work and practicalities and the introduction, just so that once you do click the link for the video or you start the therapy, that the client feels really comfortable with that. And to be honest, I've not had any problems. People have generally taken to it really well and been comfortable with it. And I think are really understanding given the need to change how we work because of safety.
Absolutely, everyone's really adapted with it, even in the legal world as well, both sort of coming along to virtual assessment meetings and hearings and being very accommodating. Do you have other considerations that apply when you have to obtain consent from any of your patients to actually participate in online therapy as opposed to face-to-face? Is the consenting process different?
I think, we just as we would face-to-face, we always make sure the client is fully informed about what to expect. And we would still have consent forms which we can email to the client for them to sign. And so they have something in writing as well, which will back up what they've had we've spoken about on the phone. So we follow similar procedures really in terms of making sure everyone's completely understanding and comfortable about what they're engaging in.
There's quite, from a client perspective, a sort of perception as to what therapy looks like when you attend face-to-face. How do you then recreate that sort of safe therapeutic space online in the virtual world? What sort of reassurance do you provide around that to them if they're sort of particularly anxious about it?
So I think what we need to consider is when a client's attending a face-to-face appointment, there are lots of cues in terms of coming into a clinic room and the informal chat and the informal meet and greet in the waiting area. And I think it's about making sure that you've got the time to spend to put the client at ease and to explain to them about where you are, what your space looks like, to ensure that that is confidential, that you're taking all the precautions that you would if you were meeting with them in a clinic room, and also to make sure that they have that at their end as well, because a lot of people have other people in the house or children, and so it's about being able to be flexible and to make sure that they're really comfortable. I've even said to people, maybe if you wanted to use a code word, so if we're talking about something and they have a family member walk into the room, that then to ensure privacy, all sorts of things that you can talk about at the beginning of the session to ensure that the person feels that their confidentiality is ensured and that they feel safe in engaging.
And are there any practical points in terms of setting up the room for the client that you advise?
So I would always ask the client, to make sure they're comfortable, ideally, sitting in a chair or on the sofa. Get some tissues, some water, just as you would in a normal therapy room. Make sure it's comfortable. Maybe if there are other people in the house, ask them to put some entertainment on in another room just to ensure sound doesn't travel too well. Maybe wearing earbuds or headphones can be really helpful, because then it can improve the sound quality and help with the confidentiality. I also ask clients to try and think about location, and also what they're wearing, because how they present, even though I might not be able to see them if it's a telephone consultation, they know what they're wearing. And if you prepare for a session just as you would if you were coming into a clinic room, it puts you in that frame of mind to engage in the therapy rather than it being just sort of a casual informal chat.
Definitely. And how have you found dealing with the technology side of things? I know it can be hit and miss at times. Do you have a way to prepare clients for using a particular platform, or sort of, because for some people that can be quite daunting in itself?
It really can, and I found that I take that very much on an individual basis. So obviously we have to be really, really careful about security so that we ensure that people's privacy is maintained. But that aside, once we've looked at those different platforms, I'll always talk to somebody at the beginning of the session before we start out to find out what they're comfortable with. And sometimes we've moved from video to telephone or back to telephone. We have had some issues where people haven't had great Wi-Fi and things have dropped out. So I'll always talk about a contingency as well. So if halfway through a session, the Wi-Fi goes or the phone goes flat, what are we going to do? Just so that it's not stressful for the client if that happens. Or giving them an opportunity to go and get a charger, or to plug in, all those kind of things. I find if you talk about it and you sort of reassure them that if they get cut off, how many times you'll try again, or what sort of make sure you have telephone numbers, or even a landline, if mobile's signal's not great, just so the client feels comfortable that they know what's going to happen.
Definitely. And if that client's supported by a carer, which often many of our clients are, do you ever spend time with the carer sort of helping them understand how to set up that session for the person that they're caring for?
Definitely. And I think it's about being really clear with boundaries as well. So you can talk to the carer and the client, and to say, how long the client might be have the carer with them, how long that, do they want them to join them for so much of the session just to make sure everything's running smoothly? Where are they if they should need some help during the session? They need some support. Just as you would really if they were coming into the office. Sometimes people are accompanied, and you would be able to say, well, if we need some support, we can go and get them from the waiting room so we know where they are. And so I think it's about just ensuring people again feel safe and supported, and that reducing any anxiety about being able to manage difficulties that might arise.
We've obviously had this huge shift in terms of how we access therapy now, and people don't have to travel anymore, so that's obviously cutting down on their time. And probably their level of stress and concentration before they actually attend an appointment with you. Has it impacted, or have you found an impact on the timing of your sessions with your clients on an individual basis?
I think it's really important because people don't have that travel time, that they spend time before and allow time after the session to mentally prepare and to think about, and to make sure they have all the resources and everything planned. I think people, when they're at home in their environment, it can feel a lot more informal. So it's about still valuing that therapy time and trying to make the most of that time, whether it be an hour or however long it is that they have face to face. I think not having to travel for both the client and the therapist is really helping in terms of flexibility and length of appointments. So because we don't have to travel to clinic, we're not having to adhere to specific clinic times. You know, it doesn't necessarily have to be 9 to 5. People are finding that really beneficial, and people who perhaps would only want a half an hour session but would find that sort of maybe too short a session if they're having to take a lot of time out of work and then travel at both ends, it means that that's available to them now.
That's a real positive, definitely.
It's a real positive, so we can be much more flexible.
Definitely, particularly for those with children as well, as
Yeah.
some of our clients are, so they're not having to move the entire family into the city, come back out again, sort of thing.
Yes.
Many of our clients, and I'm sure, and as you've met many of them, have complex needs. The people that we work for have generally experienced something quite catastrophic, or they've had treatment that hasn't really gone according to plan. With that comes a range of symptoms in itself, physical symptoms arising from that, and things like fatigue. How do you manage more specific issues like fatigue within those sessions? Is it a matter of taking regular breaks, or sort of how do you work around that?
I think as with face-to-face, you have to be really aware of when perhaps somebody's concentration's going. Look out for, so you listen out for the cues. If you just on the telephone, or if you with somebody with a video link, you can really look out for cues that somebody might be fatiguing or need to take a break. And I think it's quite okay to keep checking out with the person how they're feeling. And I do a lot more reflection as well, because it's much harder to pick up on non-verbals. So things people are telling us with our bodies than when you're face to face, and that goes both ways as well. So I think it's always worth checking out with the client, doing lots of reflection, summarizing, just making sure that you understand what they're telling you, that they feel comfortable. And I found that really works to help the person at ease. And you know, it is more tiring for both parties working via a video link. So sometimes just be mindful that people maybe can't manage the full hour that they would manage if it were in a face-to-face session.
Okay, that's good. So there's a lot of practical tips in there from what we've spoken about in terms of how clients can do some very simple things to make that therapy more effective. If they would like to get in touch with you or receive a referral to come and sort of have a session with you, how do they go about contacting you?
So the best way is via email to contact me, and then I will always get back as soon as I possibly can. Do you want me to give my email address?
Yes, please. That'd be great.
Okay, so my email address is nicola@nicolawinfield.co.uk.
Wonderful. And we'll pop some slides at the end of the webinar as well, just so people have those written down. But thank you so much for your time today. Really grateful. Thanks, Nicola.
Thank you, Fran. Bye.
Bye.